We're talking today to Vanessa Martin and also with Shelley. Vanessa is Human Rights and Participation Practice Developer with Walk.ie, and Shelley is involved in a project that she's going to tell us all about very shortly. So we'll start with you, Vanessa. You might tell us about Walk, what they do, where it came from, all that type of stuff.
Yes, so Please. Walk is an organisation that supports adults with intellectual disabilities to live the life of their choosing with dignity and respect and be included in their community of choice. It was founded in 1967 by a group of parents and friends who wanted to do more. They realized there wasn't much out there at the time, and so they came together, a very small group, and that's how Walk was founded. And since that time, it's grown now that we have, as Shelley was saying, day supports, we have supported living, and we have an employment team, and also now new is networks, and we're really just focused on, again, giving people the best life possible, a good life.
Very good. You're part of a wider community according to your website. What does that mean to Walk?
Yeah,
What's the day-to-day like?
Yeah, so I think the focus is it's really individualized. So it's up to the person that's being supported. Again, what a good life looks like for them. So it would be building a relationship with the person, finding out what are their interests, what are their hobbies, what are their strengths, and then based on that, trying to connect into those spaces within their community. So, for example, if somebody loved poetry, connecting into a poetry group and building those natural supports and relationships within communities.
Now, if I'm a parent and I have a child or an adult in my family with a disability, and I want to get in touch, or I want to see, can I get my son or daughter into your service? How do I?
So that wouldn't be my area, but from what I know, we have a referral. It's through a referral service, and I think you'd have to get in touch with the HSE. Right. And then we do have a referral coordinator who would be in contact and handle that process.
Very good. Who do you help? You say it's people with disability. Is it all people with disabilities, and is it all disabilities?
Yeah, so Walk supports people with intellectual disabilities and typically school leavers 18 and over. But obviously there's a wide demographic as well, like I say, with supported living. So there are people in an older age group as well. And yeah.
Very good. Shelley, I'm going to bring you in now. You might tell us a bit about what you're involved in.
I was a part of Walk Day service, and now I just joined the Networks programme.
Very good. And when you say part of the day service, you attended every day like any other person with a disability would?
Well, I was only part-time with the day service.
And what did you do?
I went to the gym, I done workshops. Sometimes I might go on a day out with them.
Do you remember how you got there?
My mental health nurse told me about Walk.
Okay.
Bernadette, and she introduced me to Walk, and that's how I started.
That's a good idea. And do you remember your very first day?
My first day, I was a bit nervous, but it took me a while to get used to the place.
And what kind of activities did you get involved in?
I done cooking courses.
Oh, lovely.
And I also done workshops. And I used to go to the gym.
Very good. And what about the other people? Did you get on with everybody?
I did, yeah.
Excellent.
Shelley and I, sorry to cut across, we met each other. Shelley joined the Walk Self-Advocacy Group in the first year of its formation. And Shelley's a really, really strong self-advocate. So maybe if you want to share a bit of the project you worked on for the self-advocacy group and conference.
My project for the self-advocacy was on housing. And it was all about speaking up for other people that were going for houses. And I was on 6 years on the housing list, and it's 7 years, and it took me a few years. Then I got to meet the housing minister, Dara Breen.
Oh, very good.
And after that, eventually, I just got news that I got my apartment 8 months ago.
Oh, brilliant.
And
Where?
it's going well in St. John of God's, Tessa House.
Brilliant. And you have your independence now.
Yeah.
Brilliant. Very proud of. You're very proud of that.
I am, yeah.
Actually, yeah. And you are involved in all those activities in Walk. What do you do now?
Well, at the moment, I was doing work experience in the Green Kitchen for a year, but now I'm back doing more work experience I started yesterday in the GPO.
Oh, brilliant. That's a great job. What would you like to do in the future?
My top priority is to work in a canteen or a cafe, but we see how it goes.
Brilliant. I wish you the very best.
Yeah.
Vanessa, I might come back to you, and I'll be back to you again later.
Sure.
So, tell us a bit about your supported living services.
Yeah, so supported living, again, it wouldn't really be in my area, but we do provide that for people to live in their community, and kind of like Shelley's saying, with the right supports. So that's our supported living.
Very good. Your role is in human rights and participation practice. What's all that mean?
Yeah, it's a tongue twister.
Isn't it? Especially for me.
It took a long time for me to get that title down, but I've got it now. So I can't get any other job because I finally learned the how to say it.
Yeah.
But so kind of as Shelley was saying, the main part of the job is supporting people, empowering people to use their voice, to speak up for what they want for their lives. And sometimes, as Shelley's saying, it's self-advocacy, but you end up advocating for other people as well. So the self-advocacy group was formed in 2024, our first one. I would support that, and then I support the peer reps as well in Walk to share information and for them to have a platform and a space for them to use their voice, to speak up for, again, what would make a good life. I support the peer reps as well, and Shelley, you are also a peer rep to come together and help inform the Walk strategic plan. So that was quite a bit of work where the peer reps went out to each location, asked their peers what would a good life look like, and then the peer reps came back and fed that back to our CEO, Joe Mason. So there's different kind of initiatives, just making sure there's lots of person supports, voices involved throughout all of the work and influence through the organisation.
I read your website, so I always do that, and get loads of information, and there's loads of kind of high level information, but it doesn't explain the day-to-day of a person being in Walk. Can you?
Yeah, so I think, again, it's hard to say because every person's different. So just for example, there's some people who would be employed every day. Right. There's someone I know who's an intern at Pfizer. So we also have internship programs with the Tala Hospital, with Pfizer. So some people would be not in the day service, but being in different places of, like Shelley saying, work experience or employment. And then there's other people who would be supported to maybe join, like Shelley saying, a gym class or a cooking class or a college course. So it's really individualized to each person. So it wouldn't be the same for everybody. Yeah.
So somebody sits down with that person, goes through all the things they want to do, all the things that they might need, and sets them on the road.
Yes, exactly. Excellent. Around what's the best life for you, because for everybody that looks different.
And do you do some of the important stuff like money management and budgeting and all that type of stuff? Yes,
we would have some workshops around that as well, and around personal finance and banking.
It's kind of very important if the end product is independent living, which I think it is.
Yes, I think so for most people, yes. And just back to the self-advocacy group, a lot of the work that I would do as well is teaching and educating people about the UN CRPD, learning about disability rights, and learning about even that you have, you have the power to live where you want to live, manage your money, travel where you want to travel, date who you want to date. It's
very important, isn't it?
Yeah, make sure you're getting the best healthcare, you have a good GP.
Yeah.
So because a lot of times as well, people haven't been educated, they've been excluded from education, and they don't know about their rights. So the first part about self-advocacy and speaking up for your rights is learning about your rights. And then in our group as well, we would have a drama facilitator come in to help us practice speaking up. Because unfortunately sometimes, and not with any bad intentions, but people with intellectual disabilities, maybe parents might speak on their behalf, or staff might speak on their behalf, or whoever. And really, the idea is people need to be speaking up, empowered to speak for themselves for what they want. That's really a lot of the main purpose of my work.
Very often, parents of, say, children with a disability, they tend to cosset them a bit and put them in the background a bit, and they don't teach them about things like life and all the things like money management, budgeting, relationships, which is a huge thing, and it does happen. They hide them from all that, which is wrong.
Yeah, there's still unfortunately a big stigma, and this is something that we talk about and we try to challenge why. And Shelley and myself have been involved as well with TUD. Yeah. Shelley was a guest lecturer for the second year social care students, where we do talk about kind of the stigma around people with intellectual disabilities, how they're still treated like children or seen as children. And we're really trying to break that down to say, no, the only framework, the only way to see it is through the UN CRPD, which is helping and empowering people to achieve those rights. Independent living, like you're saying, finances, health, sexual health, mental health, accessible information, right to education with the right supports. A lot of people don't realize that they have these rights. They can ask. It's not a nice to have. These are your rights. Yeah. And you can make a complaint if they're not being upheld.
And that's very important, that you can actually go and make a complaint. That's really nice. So Shelley, come on back in and talk to me. What's your role now? You were on a committee there. Tell us about that.
I recently joined a networks program, and Vanessa's my go-person.
Right. And what's networks all about?
It's all to do with stuff in your community area. Like, I'm part of a choir.
Right.
I'm part of the Sister Shed. Me and Vanessa, we brainstormed a fitness place, so we're going to do a aquafit class in Club Vitae near me in Tala.
That's brilliant, isn't it? That's a really good idea.
And we're brainstorming about jobs as well.
Yeah, about jobs for people that
in Tala area.
Use work.
Yeah.
That's brilliant.
Yeah, I think.
And what about? Sorry.
Yeah, I was just going to say it's about networks is really focused on because sometimes in day services, not all the time, but sometimes there can be outings where it might be more group outings, where networks is more about really focusing on, say, Shelley and I going to the fitness class, but really meeting people in that local area and more inclusion. With everyone else. So it's not just a disability exercise class. It's just I don't like that language, but mainstream, regular class, and meeting people, getting to build your relationships and connections in Tala.
And tell me, I want to talk to you about a few things. Are you good at managing your money now?
Yeah.
Were you before you got there into walk?
Well, I can manage my money right. I have a bank card, but I also my ma does keep my money in her place, and I take it whenever I need it.
And now that you have your house, are you good at managing the bills that come in? That's really important, isn't it? That you don't get in too much debt.
Yeah.
And what about a boyfriend?
Not at the moment, no.
I'm not looking. I've no chance of it. One thing I was taken with, I thought was fantastic, and I think it's fantastic for most organisations, is real life stories. Life stories of people who have been through walk. That's really uplifting, isn't it?
Yes, yes. And at the conference, so the self-advocacy group, and you're invited as well in October,
Right.
we'll host a self-advocacy conference, and people do share their lived experience and their story. So Shelley, you presented
I presented my housing project at the conference.
Now, when you say a housing project, what is it about?
It's all about speaking up for yourself, and what place you want to get in their future. And it's all about living in your community area. It's all about living near your family and your friends.
And one last thing, you met
I met the Minister, Darrell Breen, as well.
What was that like?
That was very interesting.
Where did you see him?
In Leinster House.
Very good. And did you talk face to face with him?
Yeah. And he wanted to listen to my housing project twice.
Yeah. That's great, isn't it?
Yeah.
And did you think that he was excited by the project?
Yeah.
Excellent. That's great feedback. Well done.
And I also met the president, well, before she got the president, Catherine Connolly.
Did you?
Yeah.
Very nice. How?
We went to some event in Cadogan.
Right. And she was there.
Yeah.
And you got to the front and went.
So I have a picture in my apartment of me and Catherine Connolly looking at me.
Oh, you haven't. You have a picture of Catherine Connolly and you.
And you, yeah.
Now you have it.
Yeah.
And sorry, Shelley, you're also a member of the advisory board at TU Dublin.
Yeah.
So you're part of the advisory board for social care.
Yeah.
The social care programme.
Do you get any time to yourself?
I'm
really.
a busy woman.
Yeah, I'm a busy woman. Oh my God.
I like the nightlife. I like to go out nights out and stuff.
All right.
I like to go to shows. I like to go to concerts and other stuff.
Oh, very good. And your favourite concert that you've ever been to?
I go to take that in June and July
God.
in the Viva Stadium.
Excellent. That'd be nice, wouldn't it? Yeah. They're very good live. Very, very good live. So Vanessa, I'll come back to you and we're coming to the end of our interview. Is there anything else you'd like to talk about before we go? So you mentioned conference. Tell us all about that.
Yes. So Shelley was saying she presented her project at the 2024. So it's called the Walk Self-Advocacy Conference,
Okay.
and we invite different advocacy groups, different allies, human rights partner organizations to come, and hopefully government representatives, individuals from the HSE, ministers of housing, different people who can hear these projects from lived experience, and so. Yeah, it's just been really successful. The last year's conference, we did have a presentation as well from Gig Buddies.
Very good, yeah.
I will mention that. So the Walk Self Advocacy Group is the first pilot project in all of Ireland to be involved with the Gig Buddies program, and so there was a match there that talked about how it's changed their life in terms of building relationships and friendships and being out and, like Shelley's saying, into nightlife and trying new experiences. And we have people that come in to talk about really just lived experience. So the self advocates would pick one of the human rights. So Shelley's Article 19, so living independently in the community.
Yeah.
That there's different ones. Some people talk about mental health. Some people talk about going to college. Some people talk about the housing. There's someone talking about the housing crisis.
Yeah.
So housing, but different. How it's not accessible and affordable. Whatever's personal to this to the individual. But of course, we know the ripple effect that has for others as well, because if one person's saying it, there's probably loads of other people that are
particularly
the same.
on issues such as housing. Mm-hmm. Housing is a huge issue.
Yes,
across many forums.
Yes, we had another self-advocate last year that Dublin Bus was invited to the conference, and the self-advocate was sharing that the schedules are not accessible to read. It's very hard to read the schedules.
Right.
And, had some suggestions around how to improve it. So the conference also isn't just about the word moaning, giving out. It's about solution. It's solution focused.
Yeah,
so here's kind of the barriers, the challenges, and here's some ideas we have to make it better. So
that's good. It's not about moaning.
Yeah, it's not about moaning. It's positive. There's the solutions. Yeah.
Lastly, if I want to get in touch with Walk, how do I?
You can email me. You can send us an email. Obviously, you can email myself. I think on the website there should be an admin.
On the website, give out the website.
Yeah, so www.walk.ie
right.
is the contact.
Right, ladies, thank you so much for coming in.
Thank you.
It's been a lovely chat. Shelley, thanks for talking to us.
Thank you.
You're very good. And Vanessa, always a pleasure.
Yes, thank you for having us, John, and thanks for inviting us.
Thanks for talking to us at Disability Matters.